having some trouble falling asleep? Okay. Let's just make sure that you're nice and comfortable, okay? We'll get you tucked in a little bit. There we go. Okay. Okay. And how's your temperature? Not too hot, not too cold. Okay. And you're feeling alright? Okay, good. You just let me know. Alright, good. So, today I'm just going to be assessing you and your sleep habits, okay? I'll begin by asking you some questions about your sleep, your bedtime routine, your lifestyle, things like that, okay? And then I'll do a quick medical check on you just to make sure that everything's alright, okay? And then based on your responses, we'll do a couple of sleep treatments on you to help you relax and get a good night's sleep, okay? Does that sound alright? Good, okay. So, while you're nice and awake right now, I'm just going to ask you some questions, okay? Good. Okay, so just so I can get a better understanding of your lifestyle, what is your current profession? Okay. Alright. Yes, a lot of times our jobs can add to our stress and impact our sleep. Okay. And what time do you typically go to sleep at night? On the weekdays, let's say. Okay. And what about on the weekends? Okay. And what time do you typically wake up? Let's say again on the weekdays. Okay. And what time do you typically wake up on the weekends? Do you sleep in a little? Okay. I'll put that down. And how long does it typically take you to fall asleep? Okay. And is that pretty normal every night, or does it vary from night to night, would you say? Okay. So it takes you some time. I'd say that's above average, but it doesn't sound like that's a main struggle of yours. Do you typically wake up at night, throughout the night? You do, okay. Is that pretty common? Okay. Write that down. And about how many times would you say you wake up in the night? Okay. And what would you say the main reason is as to why you're waking up at night? Is it due to a partner? Is it just discomfort? Is it having to go to the bathroom? A mix of things? Do you have nightmares? Okay. Okay. Good. And do you have difficulty falling back to sleep after you wake up at night? Occasionally? Okay. Alright. And what would you say that depends on? Okay. Yeah. So your mind just kind of thinks a lot at night, keeps you up. Yep, I can understand. Do you meditate at all by any chance? Okay. Alright, and do you use an alarm clock? Or do you wake up naturally? You need an alarm clock, yeah, of course. Okay. Alarm clock. And is your alarm clock very loud, or is it quite quiet? Does it wake you up in a time interval, gradually getting louder, or just an abrupt noise? Okay, yep. I would recommend getting a sunlight alarm clock that wakes you up with light. Yes, I use one of those. I find it really helpful to get up and feel very refreshed in the morning. And if you were to rate your energy levels throughout the day, where 10 is the highest, what would you say your rating would be? Okay, about a 5. Okay, so you could be getting better sleep. Yes, okay. And can you walk me through your nighttime routine before you go to bed? I'm just curious what your typical habits are. Yep, say maybe an hour or two before bed. What do you typically do? What types of activities do you engage in? Okay, so you don't eat close to bedtime. Okay, that's good. Do you have a lot of screen time before bed? Sometimes. Okay. Okay. Brush your teeth, wash your face, okay. All the normal things. Do you get in bed quite early on and then relax in bed for a while before trying to sleep? Or do you get straight in bed and go right to sleep? You hang out a bit? Yeah, okay. Yeah, that's okay to relax and wind down. Do you find that your screen time disturbs your sleep? Okay. It helps you sleep, okay. You watch relaxing videos? Okay, very good. And do you find that helps? It does, okay. I'm glad to hear that. Okay. Now, I'm just going to list some medical issues, okay? If you could just say yes if you've experienced any of the following in the past, okay? All right. Headaches? Okay. Dizziness? Okay. Fainting? Okay. Memory loss? Chest pain? Shortness of breath? Muscle or joint pain? Okay. Night sweats? Okay. Hearing loss? Sinus pressure? Congestion? Mouth sores? Eye pain? Heat flashes? Okay. Anxiety? Insomnia? And depression? Okay. Thank you very much for that. So, we're going to move on to just a brief medical check, okay? Good. Okay. So I just have my stethoscope on, okay? I'm just going to check your breathing right here. If you could just breathe normally for me, okay? Good, okay. Very good. Okay. Okay, good. Now just take a nice deep breath in. Inhale. Good. And exhale. Okay. And again. Inhale. And exhale. Good. Okay. And one more time. Inhale. And exhale. Okay. Very good. That sounds fine. Okay. Alright. Now I just want to check your temperature just to make sure that you don't have a fever, okay? So if you could just open up your mouth. I'm gonna just stick this under your tongue, okay? Good. We'll just hold that there for a few seconds. Okay. Good. No fever. Great. Okay, now I'm just going to take your temperature, okay, to make sure that you don't have a fever. So if you could just open up your mouth, stick this under your tongue, okay? There we go. And we'll just hold that there for a few seconds. Okay. Alright, perfect. No fever. Now I want to do a quick check if you could just stare forward for me. Just taking a look at your pupils, the whites of your eyes. Okay, it's gonna come in. Look at the other side. Okay. Very good. Okay. Could you tilt your chin up for me? Just gonna look in your nose and open your mouth. Very good. All right, perfect. Okay, and you said you weren't experiencing any joint pain, muscle pain, any chest tightness? No? Okay. And what about on your neck? Any swollen glands if I just press here? That's okay? Alright, it's good. I'm just going to press on your arms and a little bit on your legs. Okay, just let me know if you feel any pain. Okay? Alright. Is this arm okay? Alright. And over here. Okay. Any pain? No? Okay, good. Okay. I'm just going to feel down your legs, okay? Okay. And I'm going to lightly press on your feet, okay? Right. Okay. Good. Okay, so you're not feeling any physical pain. Good. Now, just to help you calm down, I'm going to give you a quick facial, okay? Just to cleanse your skin and help you feel nice and clean and refreshed and ready for bed. Okay, I'm just gonna grab the facial cleanser. Okay. Go. Just spray that onto a cotton pad here. Okay, there we go. I'm just going to gently wipe your skin with this, okay? There we go. Just relax. You can close your eyes. Okay. Okay. I don't notice you have any products on your face, no sort of makeup or creams or anything. So this is just going to clear away any sort of dirt or sweat from the day, okay? Good. I'll just come over here. There we go. Okay. Up here. Okay, great. And now I'm going to apply this sleep mask, okay? You can see it is a soothing restoring overnight sleep mask. Okay, good. So we'll just put this on you. Grab a little bit of that. Okay. That to the side. Okay. And we'll just dab that in to your skin. Okay. There we go. Good. Just rub that all around. Okay. Good. Just clean my hands 1 second. Okay. And finally, I'm going to apply a facial serum on you, okay? And I just want to ask permission before I do so. It does have some CBD in it, which I find to be very soothing and effective for getting a good night's sleep and helping to relax your mind and body. So are you interested in trying it out? Yeah, okay. I can show you what it looks like here, okay? Yeah, alright. Just to get a little bit of that. Okay. Put this on my hands. Okay. There we go. I'll just dab this as well around your skin. Okay. There we go. This one smells really good, yeah. It's very calming. Okay. Alright. Great. So now that your skin is nice and clean and soothed, I think that you could benefit from a Reiki energy session today before you drift off to sleep, alright? Yes, I find that Reiki energy cleansing and healing is very effective for balancing your energy, restoring your energy, and relaxing the body, especially before bed, okay? So, if you could, just take a couple deep breaths for me, okay? So, just inhale. Good. And exhale. Very good, okay. And one more time. Inhale. And exhale. Okay. Keep doing nice deep breaths, okay? Just focus on your breath. I'm going to begin by just spraying the air with a refreshing essential oil spray, and then I'll begin the Reiki treatment, okay? I will be hovering my hands like this above your body. Occasionally I might engage in some very gentle physical touch, okay? Is that alright with you? Okay, good. So let's just spray the air like this. Good. So just keep taking nice deep breaths for me. Right? I'm just going to start with some scanning, assessing your energy field. Okay. Feeling for any negative energy or any areas that could be worked on soothing any tension or tightness, any anxiety, and letting the energy flow, getting rid of any toxic thoughts, anything that might be clouding your mind. Okay. Some plugging here of the negative energy that I can sense. Just kind of drawing that out, bringing it to the surface. Getting rid of it. Getting rid of it. Getting rid of it. Getting rid of it. Okay. Good. I'm just gonna work on your legs and your feet. Okay. All right. Okay. Good. Right. Now just some gentle physical touch. Okay. Are you still feeling comfortable? Good. All right. Okay. Great. So that will conclude today's session. Mhm. I hope that you're feeling much more relaxed and ready for a good night's sleep, okay? Don't hesitate to come back if you would like a sleep experience like this again, okay? Of course, it was my pleasure. Thank you very much for being here today, and I wish you a great night's sleep, okay? Sweet dreams.